Hi everyone, today I'm going to be presenting on Middle East Respiratory Syndrome, also known as MERS. So what is MERS? Middle East Respiratory Syndrome is a severe viral respiratory illness caused by a coronavirus that is called Middle East Respiratory Syndrome coronavirus. I'm sure we're all pretty familiar with coronavirus, but I'll still kind of give an overview of everything. MERS was first identified in Saudi Arabia in 2012, so it is fairly new. Coronaviruses are a large family of viruses that can cause diseases ranging from the common cold to SARS and COVID-19. Some more information. MERS mainly affects those who live in or travel to the Arabian Peninsula. Some common countries in the Arabian Peninsula: Iraq, Iran, Israel, Saudi Arabia, Syria, a few others, but those are the common ones that see most of the cases. Since the first case documented in 2012, there have been fewer than 2,600 cases that have been reported. About 35% of MERS cases reported have resulted in death. There have only been a handful of, I want to say, two cases that have been reported in the United States, and those two were healthcare workers. So due to that, MERS is very low risk to the general public in the United States. Some signs and symptoms of Middle East respiratory syndrome. A lot of these are common with just a viral respiratory syndrome and similar to that of COVID. So you have fever, cough, shortness of breath, diarrhea, nausea, vomiting. Pneumonia is also common to develop, but it's not every time patients are developing, just every so often. So how does MERS spread? So MERS is a zoonotic virus, which actually means it is transmitted between animals to people. This virus is commonly spread by camels to people with direct or indirect contact. Actually, the only human-to-human transmission reported has been in a healthcare setting, and that was among close contact from an individual who had already been infected with MERS. So most of the transmission is coming from the interaction between human and animal, in this case, camel. Fun, interesting fact that it actually does not spread as quickly as COVID-19 does. As we saw, COVID-19 was global, very fast, and MERS is not like that. So who's at risk for MERS? Um, just simply, like I said, that it really only is common to happen in the Arabian Peninsula. So those living in at-risk member states, which is what the World Health Organization lists them as. So those living in the at-risk member states of the Arabian Peninsula. Also at risk, we have those who have recently traveled in or near the Arabian Peninsula, those who have worked in or visited a healthcare setting in that area as well, those that have had direct physical contact with camels, or those that have had direct or indirect contact in the past 14 days with somebody who has had signs or symptoms of MERS, or those who have tested positive. Some more at-risk facts. Those with weakened immune systems or have underlying health conditions are at a higher risk to develop those severe symptoms. MERS can either have no symptoms, can range from no to mild to severe, so it's kind of a wide variety of symptom types. The 35% of people who have died from MERS, a higher percentage of those had the pre-existing medical conditions that cause them to have the weakened immune system. So those with cardiovascular disease, chronic kidney disease, cancer, diabetes, any of those that can compromise your immune system would have you at a higher risk to develop the severe symptoms. Prevention and treatment. So there is actually no vaccine has existed to protect individuals against MERS. If you have signs or symptoms and you are in one of those countries, there are lab tests that can determine if you have active MERS. But the main prevention tips are to practice safe hygiene, so wash hands before, after touching camels, avoid drinking raw camel milk or eating camel meat, avoid close contact with camels. The treatment does not have a specific antiviral treatment, so often patients who received the medical care are given medications to relieve those symptoms and reduce their pain that they're and discomfort that they're feeling. So many organizations like the World Health Organization and the CDC have continued to work with those in-member states that commonly see MERS outbreaks in cases, and they're trying to work with research and trying to come up ways to mitigation strategies and prevention and further treatment. So yeah, thank you for watching.